The assessment station is a 15-minute station. It's the only station where you will meet a real live actor. The other stations just have mannequins or a silent written base where you're writing paperwork. Here you're actually being tested on a set of skills which include observation skills, so you can spot safety problems, taking observation and seeing patients' reactions and conditional changes. Communication, so good communication, explaining everything to the patient and writing it down properly, and also good documentation, so you're signing, dating everything, and it's clear and legible. Do use the SHIP IELTS introduction, which is covered in this part, in the assessment bit of the module. Have a look at that. And also make sure that you explain to the patient why you're there and screen for privacy and dignity. The patient in this case is a neurological patient, so make sure that you speak slowly and carefully, addressing all their issues and problems such as comfort and if they are distressed or confused about anything. Use a slow voice and your tone should be even. Being quick, sometimes if you're rushing through it because you're nervous about time or about the exam itself, can be detrimental to the assessment. Do gain consent though when you take the OBS and you do the assessment, even though the patient may be slightly confused. You need to do a full neurological assessment on the patient, which is following the GCS chart, and also take a full set of OBS, which need to be completed onto the chart. If your patient appears to be disorientated during the GCS assessment, do reorientate them to time and place. Make sure that you've given them appropriate instructions to follow and easy to follow. So do practice giving these instructions. After everything's finished and you've documented, check your chart. The chart again is the main focus of the assessment, and any mistakes on this would lead to a fail. Do give the patient the score of the GCS and the examiner and explain the significance of this and whether you needed to speak to a doctor. If their GCS has dropped, the doctor should be contacted immediately and they should be put on half-hourly neuro-obs. If their vital signs come up deranged in any way, you should ask them if they have normal parameters which are outside what we would class as normal, and in that case also take that into account. But also you must tell the doctor again if they have normal parameters which are outside what we would class as normal. Advise the patient when you will next see them, so I'll come back in half an hour and check you, but if you need me before then, please do press the buzzer, and do emphasise to the patient that you will come back and see them as required. If the patient is confused, also mention to them it's a temporary situation. It's quite common following a head injury and they should feel back to normal within a short period of time. You're going to keep a close eye on them. Any information that you have about the patient you will already have gleaned from the assessment booklet and the scenario that you were given. So use that information to talk about activities of daily living, social situation, and also it may mention any concerns they already have, so do address these. But take cues from the patient, whether they're holding their head, if they have a headache, whether they do need glasses because they're struggling to see you, or if they have a hearing aid. Any, I think, else which surrounds the patient, walking sticks, cigarettes and lighter, anything, do address and talk about appropriate healthy lifestyle. Do repeat back to the patient any concerns they have, so to make sure that you are clear about that, and ask them to repeat anything if you're not sure, if they are clear about it. And before you leave, always check the paperwork. I can't emphasise this enough. Give the patient the buzzer, advise them when you'll be back in half an hour, and of course, always decontaminate your hands.